So in view of the COVID-19 pandemic, our life has been drastically changed. So we are forced to stay inside our houses, and children starting from the nursery school to elderly people, all of them are forced to use the gadgets or systems in order to communicate with the rest of the world. So according to the American Academy of Optometry, computer vision syndrome is defined as the complex of vision and ocular symptoms which is associated with near vision with the uses of gadgets like computer or smartphones or e-readers. So it is a conglomeration of symptoms, and it is associated when we use system in a row for more than 2 hours and constantly. So it is usually aggravated with other environmental factors like the our posture or lighting condition, and also any pre-existing eye disorder. So whenever we are using our near vision, that is while reading a book or looking at a system, our accommodation is coming into play. Accommodation is a physiology which aids us in near vision, and it is an active process which involves contraction of our muscles. So it puts our eye into strain. So whenever there is excessive use of accommodation, there will be eye strain. But what is difference between looking at a system or a computer screen or a mobile screen and a printed material is, whenever you look at a screen, there are several factors which comes into play for the vision. That is, it depends on the resolution, which again depend on the pixel unit. It depends on the flickering of the skin. It depends on the contrast sensitivity. So all this determine the sharpness of the object, for which our eye are put into more stress. In the contrary, when you look at a printed media, it is generally in a black and white background. It has more contrast, and the sharpness of the letters are more over there. So our eye are put into more stress when we look into a system. Also, apart from that, glare of the screen also puts our eye into stress. So this is the difference between looking at a screen and looking at a reading material or a printed material. So also along with that, the blue light which is emitted from these digital gadgets can also alter the melatonin hormone secretion, which disturbs our sleep cycle. Again, it causes it affects our memory, and it causes obesity and depression. And in some studies, it has been found to affect our retina, that is the nerve layer of the eye. So whenever we look at a system, so many things come into play that involves our posture and our environment and the screen itself. So whenever we look at a system and we hunch or slouch over it, then we have this neck stiffness, neck pain or back pain, shoulder pain, headache. There can be surface problems of the eye like dryness, gritty sensation, tearing, watering, redness, vision related problem like blurring of the vision, or sometimes we can have double vision. If the person is already having some ocular problems like using glasses or contact lens, these people are also more to develop such ocular symptoms following use of computer. Prevention is better than treatment. So there are few lifestyle modifications which we can do for preventing computer vision syndrome. On personal level, if you have any eye problem, you should consult your ophthalmologist or eye doctor routinely. If you are using spectacles, you should be using, or contact lens, you should be using appropriate power so that you are able to focus on the screen properly. Second is, you should maintain a proper posture and ergonomics at your workstation. So while looking at the computer, you should not, as I already said, tilt your neck or lean forward excessively. Your ears should be just in parallel to your shoulders. Your back should be straight while looking at the computer. There should be adequate rest for your back as well as your neck. While looking at the system, your hands and arms should be at an angle of 90 to 100 degree as I am showing. Your knees and your hips should be almost parallel, or your knees should be just above your hips. Your foot should be flat over the ground over a foot rest. And again, while looking at the system should be at your eye level. That is, the top of the system should be around 30 to 40 centimeter below your eye level, and also you can tilt the system up like little bit back. You should always be looking at an angle of 10 to 20 degree while looking at your system. You should not be like excessively moving your neck up or down or tilting your neck while watching the system. And also one very important factor is whenever we look at the system, our blinking rate decreases. Blinking is very much essential because it spreads the tear film around your eye, which decreases the dryness of the eye. So we should consciously blink in whenever we are watching the system or phone. Next important thing is we should give our eye the break they need. The most popular thing is 20-20-20 rule. Whenever you are looking at the system for 20 minutes, you should take a break for 20 seconds and look 20 feet away. Look to a distant place or a window preferably. In every 2 hours, take a rest of 15 minutes, and during this 15 minutes, try to do non-screen activities like take a walk, do whatever like other paperwork or nearby work, but do avoid screen during this break of 15 minutes. You can use over the counter available lubricating drop. So apart from personal factors, there are several environmental factors which comes into play. Like if you are sitting at a AC like dry air conditioned room, then it also causes dryness of eyes. Or if a vent or any vent or fan is just directed towards your eyes, it will also cause dryness. Try to avoid such conditions. If possible, you can put a humidifier at your room. Locate the places where there is excessive light, particularly behind your back or just overhead. If there is any excessive light, try to decrease the voltage of that bulb or try to use black curtains or shadows over any exposed windows which is nearby, which is affecting your vision or which is causing glare at your system. The third thing is computer related changes, that is you can make several changes in the system like to enhance the contrast sensitivity, you can increase the font size, you can apply several filters, you can use the red shift or the night shift mode, and as I have already delineated how to keep your system in the work system, you can do that. Initially, these symptoms of computer vision syndromes remit by the end of the day, but with excessive uses of system, it recurs and it is generally of severe nature. So, whenever there is excessive of dryness which does not remit by the over the counter available lubricants, or if there is excessive redness, pain, sudden decrease of vision, flashes, in such cases you should consult your ophthalmologist as soon as possible. Even though system or a computer or these gadgets have become a very quintessential part of our lifestyle, very simple modifications can help us to prevent such ocular conditions. So give your eyes the break they deserve.